Hi, this is Abby Hall, and I'm going to talk about the Hope Center Recovery Program for Women. This is a 501c3 nonprofit organization that's based out of Lexington, Kentucky. The client system is women who are 18 years and above, women who are expressing a desire to stop using drugs or alcohol, and homeless or at risk for becoming homeless women. Our budget at the agency is $547,000 a year. Clients do not have to pay. Majority of them have Medicaid. The largest funding comes from the Department of Corrections, which is our DOC clients. We also have grants and private donors. And when we have drug court clients, they pay for it. I know that a lot of our housing is funded through the Kentucky Housing Corporation. That's through the grants. We have 24/7 emergency shelter, detention center recovery program, which is a 28 lesson of recovery dynamics, cognitive behavioral intervention classes to alter the criminal thinking, and mental health services through Bluegrass Comprehensive Care. We also have social services to assist with homeless and those with disabilities, and Health First Bluegrass medical staff also treats the clients at our on-site Hope Clinic. We also have a nurse practitioner on site, employment training opportunities, transportations, interviews and orientations, stuff like that, transitional housing, and we also have a mobile outreach team that's a nurse and 2 caseworkers that help provide food, clothing, shelter, references for people who are homeless in the area. Our agency structure is there's 4 different phases. The step 1 is the Safe Off the Street, which is the SOS phase of the program. It's the first point of the program and provides a place for women to detox. Staff will introduce support and education and available resources to the clients. This is the stage where women develop their plan of recovery. These clients are mentioned daily by the nurses they're monitored daily by the nurse to make sure that they're detoxing safely. Usually you can see them, they're in scrubs, and this is usually the shortest phase of the program. Step 2 is the motivational program that shows women their expectations and requirements by the recovery program. They begin recovery dynamic classes, they meet with sponsors, demonstrate their interest in the recovery process, and this is called motivational track. That's step 2. Step 3, which is also known as phase 1, has 28 lessons that works the 12-step process for Alcoholics Anonymous through group lectures, individual workbooks, journal activities, discussion. This phase usually stresses the importance of holding each other accountable during something called community, which we have every Monday, Wednesday, Friday morning at 10 a.m. And this usually takes around 7 to 9 months. And then there's step 4, which is also known as phase 2, and that's the continuation of phase 1. So after completing the program, you're able to sign a 3-month contract for peer mentoring. These women live on site in the alumni of the recovery program. They have the option to become peer mentors, and these women live on site and are trained to teach recovery dynamic classes. So when you're in motivational track, which is step 2 of the program, those are typically taught by peer mentors. They check homework and work one-on-one with the clients and mentor the new people into the program. Our staff is kind of small at the agency. We have Stephanie, who's the head director, Ashley Ratliff, who's the social worker, Emily Howard is the parole officer. We have an on-site nurse practitioner named Danielle, and there's also a peer mentor / coordinator for each program or each phase of the program. Now I already told you our services, funding. We do have a really cool opportunity that's coming up. It's called On the Table. It's where anyone that's feeling less than or at risk for becoming homeless or wants resources, it's called On the Table. So it's actually happening in a couple weeks. You can come and get fed a full meal, and they offer pamphlets and things for different resources that are out in Lexington. But social work is the primary discipline there. It's pretty much revolves around that. I think that we do have an effective way to assess our clients because we use recovery life histories. That's pretty much the biopsychosocial assessment for the clients. We go over any sexual abuse, physical abuse. We talk about prior substance abuse in families. We talk about any type of learning disabilities. We talk about anything. And those are pretty much not open-ended questions, but you go by the Recovery Life Assessment packet, and as we ask questions, we'll end up doing open-ended questions just to get to know the client a little bit better. We also have case management, and obviously we have meetings with the staff to be able to refer clients to our outside resources. I think that something that I would like to learn more about is the single mothers. I know that we have a lot of cases with single mothers having breakdowns or feeling guilty about leaving their children. So that's become a big issue. I think something that I would like to look more in depth is the single mother or the mother's success rate versus women who don't have children. I know majority of people who don't have children are like there for themselves typically, and it's just interesting to watch. I definitely think that this assignment taught me more about the different types of data. I know I've always had like a very generic definition of what quantitative versus qualitative data is just from like school throughout the years, but I think this really gave me like an in-depth definition of what exactly it is. I do think that data is super important. Before coming to this class, I thought it was kind of just like a research, but I think measuring is super important because, you know, you can better the agency from doing that. I think the entire process is important. For example, having a hypothesis, and each step is really important just to follow, because without that, it's kind of just all over the place, and there's no way for you to make improvements to your agency if you don't have like an initial assessment or anything like that. I think that as clients are exiting the program, there should definitely be an assessment asking them, like, do they think that their mental health services are helping them? I know recovery life histories are more to figure out if a client does need one-on-one mental health counseling, because we don't offer that at the agency. I mean, we do have a social worker, but we don't have the one-on-one mental health for every client. So that's kind of the assessment that we use to refer them. But I think that as the clients are exiting the program, we should ask them how well our program benefited them, and if there is any other life skills or anything that they need to work on after or before they leave the program. But overall, I think our program is really effective when it comes to getting clients the help that they need, and our agency is continuing to grow. We have we have 80 doc beds, so we have 80 beds for the women who are the Department of Corrections, but it's continuing to grow, and I think that we're actually about to have an expansion done on it. But I think that this overall has taught me a lot of good information about the different data and how measuring is important, because before I never would have dreamt of doing any type of assessment on my agency. I just thought it was an agency that I go to get experience but in the field work. But I think that you can honestly measure almost anything, and it can be really important to build upon.